and we look forward to her input today. At this point, I'd like to just review kind of the key things we want to emphasize today are going to be deep breathing exercises, the importance of walking and exercise, and pulmonary rehab. Those are going to be our key goals to cover today. And with that in mind, we're going to talk about, first of all, why are we doing this? And that's to avoid those flare-ups. And Radhika's going to talk about that.
You're absolutely right, Bob. Thank you. We are doing this support group, having Deborah invited to talk about exercise and pulmonary rehab, exactly as you said, in order to avoid exacerbations, meaning the worsening of symptoms. I think there is not enough time always to talk about exacerbations because these are the symptoms that bring the patients in the hospital. And what are these early signs of exacerbation? Again, each and every one of us suffering with COPD, we have to know ourselves, and we have to know what are those symptoms that when they get worse, sometimes it gets to a point when we have to call 911. Everybody's different. Everybody has a different health status, and everybody is in different stages of COPD. But some early signs of worsening of normal symptoms such as shortness of breath, or coughing, or producing of mucus can get worse at times. Why do they get worse? They say, the literature says the most often cause is infection, whether a virus or a bacteria. That's the most frequent cause of exacerbation of those symptoms: shortness of breath, coughing, producing the mucus, chest tightness. Other causes would be the allergens, the irritants. We discussed about them in our last support group. So what do? Of course, we need to avoid allergens, irritants, and stay away from bacteria, viruses, avoid infections. These early signs that will prompt us to pay attention that something is not right would be increased shortness of breath. You are more fatigued than usual. There is more coughing. You reach towards your rescue medication more often than you usually do. So these are warning early signs that something has to be done. Usually what do? We rest more. We call our providers. It is very important to call your provider for advice. Then, of course, in order to avoid all this, besides what I just mentioned, is living a healthy life. And that it's comprised of good diet and exercise. That's why Deborah is here today, because she's such a great professional and she works with patients suffering from COPD, from asthma and other respiratory conditions. And we know that when we have those diagnoses, it's kind of hard to exercise, right? There is an increased shortness of breath anyway. So Deborah is going to teach us, is going to talk about these challenges. What do you think, Bob, about that?
I think that's really the why of all of this, is to avoid those flare-ups. And before I introduce Deborah, I wanted just to emphasize something. I've been a real advocate for pulmonary rehab for many years. I've had the honor to be involved in about 3 or 4 programs around the country. And if I were to put one word on it, it's wellness for people with lung disease. And Deborah is the respiratory therapist expert in our team here at Sarasota Memorial. And last month, March 12th through the 16th, was National Pulmonary Rehab Month. And I just want to belatedly wish Deborah and the Pulmonary Rehab Program all the success and thank you for what you do in our community. And with that in mind, I'd like to welcome Deborah North.
I see a few. I see a few that it sounds echoey. Is it me or just? I hear it in my ears. Maybe it's just me. but I see a few familiar faces, and pulmonary rehab basically is an outpatient-based program. The problem with once you're discharged from the hospital and if you're getting home care, you unfortunately can't come into pulmonary rehab until you are completely discharged from home care. Once you're discharged from home care and you decide that pulmonary rehab is the avenue that you would like to go, so what we'll do then is we'll go ahead and have you come in for an evaluation. And the evaluation will be basically looking at your health, your history. So from your history, we will take and do a 6-minute walk test. Some of you have had a 6-minute walk test done in the doctor's office, and we will repeat that 6-minute walk test before and after our program with us. Now, you're going to say to me, well, how do I get involved in this? You can stop by and visit our facility at Rand and Clark Road, and that facility is actually a gym type of facility, but we share it with cardiac rehab, pulmonary rehab, and a gym too. So when you come in, we will basically look at your medical records. Our scheduler will make sure that you qualify. A pulmonary function test is required within a year of service, and that pulmonary function test will give us some values, some lung function values. Now, having the diagnosis of lung disease unfortunately does not qualify you 100% to get pulmonary rehab. So once we get the information from you, and like I said, you can stop in to our facility, talk to us, look at our facility, see if it's something that you would like to do. From that, we'll take your name, phone number, date of birth, and we can contact your pulmonologist if you are local or if you are out of state. We'll contact your pulmonologist from that point. Like I said, we'll make sure that you qualify under your pulmonary function test values. Make sure in your medical records you have a diagnosis of COPD or any other lung disease that qualifies you under Medicare. Once you qualify under Medicare, we set up your appointment for your evaluation. Like I said, the evaluation takes about an hour. That 6-minute walk test, that's all we're going to do initially. Then we'll set you up for a time. We are only at our facility on Tuesdays and Thursdays. We have 5 classes during that day. Those classes consist of anywhere from 4 patients to possibly 10 patients, depending the time of year. You'll come in, we'll do your blood pressure before, after. We will also check your oxygen level on one piece of equipment. Unless we see that there's a red flag, we will do that more often. We're going to do 30 minutes of aerobic exercise. That's our goal. Now, you may come into me and say, Debbie, there's no way I can do 30 minutes. And that's fine, but that is our goal. That is where we're working towards. Once we build that 30 minutes up, we will try to increase your resistance or increase your workload. We'll also do weight training with you. That weight training will consist of upper and lower body weight machines. We do 2 to 3 weight machines. It's really going to depend on you, what you're able to do, and our time limitation. Unfortunately, it is not a full hour of exercise, but you are there with me for a full hour. On Thursdays, we'll do the same component, but we will do our education component. We'll add that to the end. So you're there a little bit longer than an hour. Education is panic control, relaxation, stress management, medications, oxygen, coping skills, disease management, disease education, infection control, ADLs, which is adaptive living things that you can do at your home to conserve energy. So those are some of the examples of our education. There's about 12 education programs. They do repeat themselves, and unfortunately under Medicare they are mandatory that you do attend. So with that in mind, now you're going to ask me how many sessions. Well, unfortunately, unless I have your medical records, if you have a COPD diagnosis and it is in your medical records that you have COPD as a diagnosis and your pulmonary function values qualify you with that diagnosis, you get 36 one-hour sessions. Any other is 18. So that's Medicare's guidelines, and it's once in a lifetime. Most insurance companies follow Medicare's guidelines. So Medicare says that they'll pay 80% And your supplement, if you have a supplement, is responsible for the other 20% of your insurance bill. If not, unfortunately, it is self-pay, that 20%. Once you graduate, we will repeat that 6-minute walk test. And we see patients increasing in distance. We see patients increasing in their shortness of breath level. We use what we call a board score. So it's a 1 to 10. So the lower the number, the better you're breathing. So we see a lot of improvements. You may not have really increased your distance, but your oxygen levels, your saturations are better, and or your shortness of breath level is better. So those are the things that we strive for pulmonary rehab, is we want to get you stronger. We want to educate you to take care of your lung disease correctly. So it's really, really important to understand it's once in a lifetime that you can do my program, unless your diagnosis changes. But that also means that your pulmonary function values have to change. Just having a new order, let's just say you went 36 sessions under COPD, now you want to come back for another 18, but there's nowhere in your documentations that says that you have asthma or you have pulmonary fibrosis. So unfortunately, you will not be able to come back for another 18. So what you put forward is going to make, basically, it's going to make everything for you. You come in there and you exercise and you do everything that you're supposed to do outside of exercise with me, which is only 2 days a week. We actually recommend 5 to 7 days of aerobic exercise. So those right there, changing your diet, the way you eat, trying to eat 5 or 6 small meals, trying to drink 6 to 8 8-ounce glasses of water, 8 servings about the size of my fist of fruits and vegetables. Easy way to get those fruits and vegetables and to increase your meals is to make a smoothie. You can use almond milk, whole milk. You can put kale in there, spinach. Use natural peanut butter for the protein. Stay away from processed foods. The sodium in processed foods will have a negative impact on your breathing. You can put any fruits in there, blend that up in the blender. Now you've increased your meals. You've increased your servings of fruits and vegetables. And those are things that are going to positively have a good effect on your breathing. Is there any questions that you have regarding pulmonary rehab that I didn't cover? I did bring some brochures, and I know if you decide that you want to start with me here, and I know I heard a few of you say that you are moving back up, or you can start here with me, finish up there, or vice versa, whatever works for you best. But the biggest thing is you really need to get yourself enrolled into pulmonary rehab as soon as you can, so that you can understand how to slow down the progression of your disease by properly taking care of it.
I have a question. I've heard that some programs have programs where you have maintenance programs. Can you describe that?
We do have the maintenance program. The unfortunate thing with the maintenance program that I offer, we really only open it up to patients that require oxygen. We try to send our patients to our gym setting, and the reason is because you're able to use the equipment all week long, where if you join the program under mine, we are unfortunately a very busy program, so I don't have the availability to open my program up more than the 2 days, so it would be Tuesday, Thursday. We basically, it's just like a gym setting. We'll still do your blood pressure when you come in. We'll still check your oxygen on one piece of equipment. But the biggest thing is you're able to do what you want without me having to dictate, treadmill, bike. So you are open in the open gym concept, but it's $78 a month for 2 days a week. So if I can put you in and suggest that you go to a gym where you can exercise 5 to 7 days a week, that's going to be your better option than just the 2 days that I'm actually limiting you to. So we really encourage you, whatever you do, you've got to exercise. If it's staying with me so I can supply the oxygen for you, or if it's joining a gym. Those are going to be the things that's going to be important. Unfortunately, Medicare does not pay for a maintenance-based program. So that is unfortunate. And the program where the facility that I'm at does not have silver sneakers. So again, something to consider when you're looking at it.
One of the reasons I ask that is that every program is different and every location is different. One of the things I want to encourage everyone with is that we also, with our program for the health clinic, have a partnership with Pretty Strong, our education insurance. And I believe everyone has access to contact with COPD Pretty Strong. And feel free to email me. I'm glad to send you a digital version of our patient education that will help you do a lot of these things 5 to 7 days a week. Emphasize a lot of the points that Deborah's making on nutrition, on exercise, so that we can help you have a safe home program as well. Because a lot of times we're balancing things in our budgets between medications and nutrition and pulmonary rehab programs. So I just wanted to let you know that we're there for you also, both the One Health Clinic and COPD Breathe Strong and the pulmonary rehab program. So we're all working together for your health.
Deborah, can you give us some tips, breathing tips, exercises, maybe something that we can take home also in terms of what should we do, how should we proceed?
The biggest thing that we try to teach our patients is what we call pursed up and diaphragmatic breathing. And I don't know if they've really gone over much with you, but anything that you do potentially has the ability to make you more short of breath. So our goal is to teach you to do pursed lip breathing. And pursed lip breathing is breathing in through your nose and out through pursed lips. And some patients learn it a little bit better by counting to themselves. So for example, you want to exhale 2 times longer than you inhale. So you would count and inhale of 3, and you would exhale to a count of 6. Now that may be a little too short, so you may be more 4 and an 8. But that is going to vary with what activity level you're doing. So make sure that whenever you, for example, drop something on the floor, when you go down to pick that thing off the floor, you want to make sure that you're exhaling through pursed lips. That's going to put less stress on those lungs. The lungs are deflated, and you will be less short of breath. So the same thing if you're going to grab something off the top shelf. You again want to exhale through pursed lips. And what the pursed lips is doing is causing a resistance to flow. So by doing pursed lip breathing, when you breathe in, that's not your problem. Your problem is your exhale. You're not getting the trapped stale air out of your lungs. So by using that pursed, what you're doing is causing backflow in your airways. So I use the example of the backflow that's on the spigot at home, on the outside spigot. The reason you have that backflow is when you have a hose attached to it and a handle, the hose doesn't pop out with big old bulges on it. So you're doing the same thing by doing pursed lip breathing. You're pursing your lips, which is causing a resistance to flow to help keep the airways open so more of the trapped stale air comes out. Exhaling 2 times longer is going to help get that trapped stale air out of your lungs. So you'll improve your oxygen, you'll decrease your work of breathing. If you're huffing and puffing, you're breathing fast, so you're not getting that trapped stale air out of your lungs, hence you're making yourself more short of breath. I know Linda's heard this one, but your lungs are like a 1-cup measuring cup. You dump out half the volume in a 1-cup measuring cup. How much can you put back in? Only a half, right? So that represents the volume that you breathe in. If you don't dump it all out from the breath before, you can't pull in a full breath of oxygen. Hence, you're going to make yourself more short of breath. So you have, unfortunately, making yourself more short of breath the faster you breathe. So concentrate on pursed lip breathing. In through our nose, out through pursed lips. The second part of that is what some patients call belly breathing. You're going to use your stomach to help the lungs. So when you go to exhale, I want you to pull that stomach in. That's going to help push those lungs. And then when you inhale, you're doing absolutely nothing because the lungs are going to fill up just like a balloon. They're going to push that stomach out of the way. So you consciously have to think, pull my stomach in when I exhale. And those two together, it's called pursed lip and diaphragmatic breathing, those two together are going to make your breathing a lot less severe. And again, anything that you're doing, when the weight machines, you're using those, you're going to be exhaling on the hardest part, less stress on the lungs. And basically, those are things that are going to help improve your quality of life, making you breathe better.
One thing I just wanted to add is that a lot of times we have people with pulmonary fibrosis rather than COPD? It might be restrictive rather than obstructive problem. Can you comment on that?
Well, you're still going to do pursed lip and diaphragmatic breathing, and we really and truly try to focus on getting you to breathe correctly. Linda will tell you, I'll go to you when you're on the equipment and say, you're not doing your pursed lip breathing, really focus on that. So that's going to benefit any single lung person to do their pursed lip and diaphragmatic breathing, so it will help. The unfortunate thing with pulmonary fibrosis is we'll see these patients are going to need a lot more oxygen when we go to exercise. Unfortunately, if you look at your lungs, think of it like a balloon. The oxygen's not getting across the membrane of the lung to get into the blood. So we need to give you more. And I know Linda's heard this one before, but I use two examples. I use a pair of nylons. Ladies' nylons are very porous. And cheesecloth. It's thick. It's what the dough is used, or the bakers use to roll out the dough. So you're going to take 2 cups of water through the nylons. You're going to get 2 cups through. So that person has lung disease, but they don't have a permeability problem. What they breathe in gets into the blood. That's why some of you aren't on oxygen. So now take the cheesecloth. That's our pulmonary fibrosis patient. You're going to take 2 cups. You're not going to get 2 cups through because the lung is thick, that membrane. So you're going to take 4 cups to get 2 cups through. So we'll see our pulmonary fibrosis patients that we will have to give them a lot more oxygen to be able to keep their saturations 88 or better. And unfortunately, I don't have an answer to why or am I going to make it better, but any exercise, when you increase muscle tone, your oxygen needs will go down. Your muscles are bullies and they're stealing your oxygen when you're out of shape. So if we can get you into better shape, we may be potentially able to get you down if you're a pulmonary fibrosis patient on your oxygen needs. But it's very, very hard when you have pulmonary fibrosis because of the scarring within your lungs.
How about some questions here from the group?
Would you try and breathe that way, in through your nose and out through your mouth, constantly?
Yes, ma'am. And the main reason is because your lungs are damaged. They don't get better the next breath. Okay? So I tell my patients, when you're sitting listening to TV or when you're just sitting doing absolutely nothing, the more you practice it, it will become second nature and you'll do it without thinking about it. And I'll see my patients out and about, and it won't be in my red scrubs, so they don't usually recognize me. And I'll see them doing it. And they're just not realizing that they're doing it. So it is a learned technique. I mean, I'm trying to teach you how to breathe in, 15 minutes that we've been sitting here? So it is something that you have to reteach yourself. But your whole objective is to have a better quality of life. So if you can have a better quality of life by improving your oxygen and be less short of breath, then that little bit of practice will always pay off at the end. Always pay off.
I want to thank you for sharing the key points about the coordination, because I've always found that walking as far as our legs and reaching as far as our arms, like when I'm taking a shower, are 2 of the more taxing times, are really good times to practice, like going from the car to the doctor's office. Comment on that.
Well, you picked up the shower. Some people aren't going to like what I'm going to say, but I tell my pulmonary patients, you need to be wearing your oxygen in the shower. It is one of the hardest things that you're going to do. So wearing your oxygen in the shower is crucial, crucial. Now when you're sitting doing absolutely nothing, you don't have to have your oxygen on. Are you exerting any energy? None whatsoever. But when you go to push yourself out of a chair, look at all those muscle groups you just used. All of those muscle groups, when they're out of shape, they're bullies. So again, the exercise is going to be the biggest thing that's going to improve your quality of life with that pursed lip breathing. So when you get those muscles stronger, you have more oxygen to breathe. Just like that 1 cup measuring cup, there's only so much volume. So everybody wants a piece of the pie. So if we can get you stronger, those are things that are going to make a difference. Walking up and down, I heard you were leaving in May. Walking up and down a flight of stairs. Again, coordinate your breathing. So do pursed lip breathing as you're walking up and down a flight of stairs. When you stop, both feet on a step, and only move as you exhale. So your ascent and descent are exactly the same. You are only in motion on exhale. Vacuuming. You push the vacuum cleaner. How should you be breathing? Exhale. Okay? My way is going to take you a little bit longer to finish, but you will be less short of breath. You try to rush through that task, guaranteed you're going to be more short of breath and you're going to be huffing and puffing. Okay? Spread the tasks out through the day. So today I'm going to just vacuum the living room, tomorrow I'll vacuum the bedroom, and so on and so on. So if you have a good day, especially if you're on prednisone and you're having a good day and you feel $1 million and you go and you do the whole house, I can guarantee tomorrow you're not going to feel like doing anything. So we tell everybody to spread their tasks out. The most important thing that you can accomplish is your 30 minutes of aerobic exercise every day. Swimming, biking, and walking are the 3 main aerobic exercises.
I didn't think you were an advocate of when you're sitting doing nothing, going without the oxygen.
Yep, 100%. There's
Let's do that then. I do it at home.
as long as you have
doing
to,
it, yes.
as long as you realize that when you push yourself out of the chair, now you need it.
Sometimes I do my 6-minute test.
She obviously has been through my program, so she knows. But that's the biggest thing.
Very cautious when I do it.
Pacing yourself is another thing. She said use the word cautious. The most important thing that you can realize to yourself is you have to learn to pace. You have to learn to conserve energy. And people say to me, well, yeah, but you're just telling me to exercise. So let's use, for example, laundry. Okay? None of us like to do it. I don't. But if you go and you're taking each single piece out of the dryer, bending, what are you doing? You're constricting those lungs. You're not giving those lungs enough time to inflate and deflate. So take the whole laundry, go sit down and fold it. Okay? That way, this afternoon, you have time to go do your 30 minutes of walking. And I'm surprised Linda didn't say something, but I don't advocate walking outside. And the reason is, you got the wind, you got the pollen. Earlier when I came, it looked like a wind tunnel in there. So all of those factors, now we had rain, so our pollen counts are going to come down. But unfortunately, all of that, the humidity, the pollen, all of those things, you would be better to exercise in a climate-controlled environment. So I tell my patients, if you don't have access to going to a mall, you go grocery shopping every week, right? Walk in the grocery store. Before you grocery shop, do your walk. Put your oxygen in the shopping cart. I don't care if you hold on to the shopping cart, but it's non-stop. How hard you work, I tell my patients you want to work somewhat hard. If I can go up to you and say, how are you? And you can't answer it because you're too short of breath, you are working too hard. Pulmonary patients do better building up endurance, not speed. Okay?
Those are great points. One of the things that one of the pulmonary rehab programs I had the opportunity to work with years ago had them all walk, and that was great. But to me, listening to you, one of the things that I would strategize is perhaps considering combining those nutrition tips with the exercise. I said, let's pretend I'm not going to do a weekly grocery list, but several times a week I'm going to make that trip to the grocery store and get the advantage of getting fresh fruits and vegetables and have that exercise combined. Just throwing out ideas. What are your thoughts?
You're perfect. And unfortunately, not all of us have the ability to grocery shop. I see some of my patients use an electric cart. So if you have access to a pool, and you're able to use a pool, if it's your own private pool, you can use your oxygen in the pool. And I've had patients through the years that have, I don't know if you've seen them, but they're rafts, and they have for a cooler. And they put their oxygen in the cooler and they pull it with that. So there are things out there that you can do if going to the grocery store is not something that, like Bob recommended, do it 3 times. around your joints, and water becomes your resistance. So it will be much easier for you to do your exercise in a pool if that's the only option that you have because you don't want to drive to the grocery store.
Take advantage of your smoothie tip. Take a
That's
smoothie
it.
to the pool.
That's it. Any other questions?
How do I go swimming with this type of a unit?
You can actually put that in the cooler. And I don't know if you've seen it, it looks like a raft. And in the middle, it's round and a cooler fits in there. Just put that right in there, and now you're not gonna have a bunch of grandchildren jumping around and splashing it, but nothing's gonna happen to it.
But you gotta keep it dry.
Right, and it's gonna be dry in that cooler. And it really is just a raft. And I've had patients that do that, and I've also had patients that bring their concentrator. You got 75 feet on your eye, right? Pull your concentrator if it's your own public, if your own private pool, public's gonna be different. Pull that to the edge and use your concentrator. But yeah, you're able to do it with that. You're gonna be able to keep it dry, unless there's a bunch of little kids jumping around, but most definitely. So those are the three that are gonna be the biggest for you, 3 aerobics.
Especially that pool is so refreshing and good for that resistance for your lower extremities as well.
There's so many things that you can do in the pool. You can go get those noodles. You can put it up underneath your arms like a horseshoe, and you can pedal like you're riding a bike. You can put your arms on the back of the wall. You can kick. You can have, if you want to purchase one of those little kick boards, you can kick with the boards. You can just walk in the shallow. You can use the water as your resistance. So it's really important to realize that there's so many things that are available to you that cost you nothing. So you just need to make that effort and to go and do them. Like I said, it's going to benefit you. That's what's important. We're trying to improve that quality of life for you.
I've been concerned about the pool and the bacteria. You see all these people in the pool. We live in a condo complex. It's not a large pool.
The unfortunate thing is they have to maintain it though.
They do, and then I see this guy that's in the pool, smoking a cigar in the pool. It kind of turns me off.
I would be right there with you. I would have problems with that
Yeah.
also.
They're changing that.
They're changing it.
We just covered that already.
Yeah.
Yeah, I mean,
Then
all
I
you
see
can
little
do,
kids in there in diapers, and I'm concerned about bacteria.
the only thing is if you're in a complex, the only thing is you're going to be able to take it to whoever the association president is and, have that addressed. That unfortunately is something that I really don't have a suggestion for except go into the right source and say, hey, look, this is something that I need to do and I'm not able to do it because of this, this, and this. That's all you really can do. Sometimes your hands are tied.
What I would like to say, I would like to emphasize again about what you said, endurance and speed. Very, very important. I know from my own experience that patients with any lung disease, especially ladies, have a hard time slowing down. Everybody works so hard all their lives and handling so many tasks. And now it's time to review this daily schedule, and it's very hard to just put on the brake and slow down a little bit, and again build that endurance. That's so important, Deborah. Among everything else you just told us. It's a great point. So we have to slow down, but we have to build the endurance, as you said, have those muscles strengthen, and take frequent breaks. I am a big promoter of that, and a big promoter of vacuuming one room at a time. And once you have a good day, I always said, make sure the next day it is another good day. So don't over exercise or overdo things. Just try to have a good quality of life, living with a condition that can be managed appropriately.
I just want to throw one more tip in there that might be helpful for people who have problems with secretions and airway clearance. That again, I'd be have information for tools and resources to help you clear your airways. It's really important, especially beginning of the day and end of the day. Just want to mention that. And before we wrap up here, I'd like to mention next month. Okay, I'm going to ask because next month we're meeting May 9th before we take a summer break. Some of the people here won't be here, so I'm going to ask for a little bit of moving ahead. What we're going to talk about next month is traveling and breathing well and traveling. And since some people will be traveling before we meet, I want to open that up a little bit for Deborah's insight, while she's here, of any recommendations that you could throw out there for people with oxygen who will be traveling.
It depends on how you're traveling. What mode are you traveling? So if you're traveling by airlines, okay. Basically, let me do airlines real quick. If you are with a cylinder, which you have, unfortunately, that is not going to be able to be brought in the airplane. So what you will have to have is a concentrator like Linda has. The unfortunate thing is not all concentrators are approved for airline flight. So depending on who you're flying with, you need to make sure that the unit that, and they are rentable, you can rent them, make sure that the unit that you have, you have 2 batteries, you need at least a 20% safety margin. Make sure that those batteries that you have enough. Other thing that's important to realize is that when you are sleeping, some portable units you cannot sleep with because they are a pulse unit. So wherever you're going, if you're staying for a length of time, you will contact your oxygen company here local. They would contact their sister company up there. They would make sure that you have the appropriate equipment. Now, traveling by automobile. There isn't a law stating that oxygen cannot go over the state line, but oxygen cylinders, especially when you are traveling, they need to be secured, as they should be secured in your home. You should not stand a cylinder up. It needs to be in a box, and we call it wheelie carts. When it's in a wheelie cart, your e-cylinders, they should be laying down flat on the ground. They should not stand up without anything holding them secure. The other thing that's important is, again, you can't fill most of those. There are some portable tanks that are fillable, but then you have to have the whole unit. So you're going to need a traveling concentrator. Traveling concentrator is going to be much smaller. Most companies have them for you to use, but they don't have many. So you need to contact your oxygen company as soon as you can to make sure that you have a traveling concentrator so that you would have the ability to take that into the hotel and sleep with it. Or if you're using your big unit from home, it's a pretty big unit. You've got to be able to slip that into the car or wherever you're going to be and then get it into the hotel to sleep with it. So there is some things that you have to plan. Also, flying, you're going to have a letter that states that it is medical equipment and medically necessary. So your physician can fill it out. Most airlines will have the form that you can print off the computer. It will be, if you use your portable concentrator, again, it's just going to look like a piece of equipment, but why go to the hassle of having problems at the airline? So just having that note saying that it is medical equipment. The other thing that I always tell my patients is go to your pulmonologist especially and make sure you have an updated medical summary. I advocate of this. You should always be carrying a list of your medications with you. You should always carry that with you when you are traveling. I myself was in a very serious accident. I broke my neck. I did not have the unfortunate ability to communicate. I went into shock. So my husband knew where everything was because I do have some pre-existing conditions. So he had my medical, all of the stuff with us. But you never know. I was on vacation with my family and I broke my neck. Wasn't expecting it, didn't know it was going to happen. I'm in the medical field. So I was prepared. My family was prepared. But do you know how many people come into an interview with me and say, I take a little purple pill for blood pressure. So have that list with you because you don't know if you potentially are going to need that on traveling. If you're in an accident or something safely happens, you don't have anything with you. Your spouse may not know that it's in your phone. okay? So it's always really important to have a med list, have an updated medical history that you're carrying with you when you're traveling.
Excellent points. You stole my notes from next month.
I'm sorry.
Thank you. Also, I just want to mention, in addition to the May 9th, Breathe Easy While You Travel, I wanted to let you know there are a couple other house cleaning things that I'd like to mention to keep going between now during the summer break, okay? One of them, for the people here still left in Florida after May 4th, on May 18th, the state of Florida is having the first ever Florida Respiratory Patient Summit with the Respiratory Society at Daytona Beach. I have flyers on the event. It's a free event, 3 hours on Friday afternoon. I'm going to give you a couple highlights so we have a minute here. We're going to have partners, COPD partners from Pulmonary Rehab and support groups from the Volusia County area sharing their stories of the benefits and support groups at Pulmonary Rehab. We're going to have a story, Jill Brazilla story. This lady recently had a double lung transplant with pulmonary fibrosis, and she's going to share her story. It's quite a story. We're going to have the future of COPD talk about telemedicine, and both from the provider respiratory therapy perspective and from the patient perspective in terms of benefit. We're also going to have a patient champion talk about opportunities in advocacy and research for people with lung disease to get involved in helping make a difference for the future and current situation. Those issues that you brought up in terms of insurance are important, that the voice be heard of both providers and patients. I'm going to have the opportunity to have a physician who is our medical advisor for COPD Breathe Strong, Dr. Keith Robinson from Fort Lauderdale, will be joining me, and we're going to talk about the ABCs of COPD medications and oxygen. And then we're going to have a roundtable discussion. So just want to let you know, I've got flyers on the event and all the information. We'd love to have some people from West Central Florida, Southwest Florida, I guess it's attend. It's going to be at the Hilton Daytona Beach Oceanfront Resort. It's a free event. The only cost would be parking is valet parking, $8. We had a special discounted rate for valet parking, $8 with a handicap sticker. And we've had a lot of sponsor support to help us do this. And I'm very thankful for that. And also lastly, for house cleaning, I just want to mention again our online support groups between now and September after May. And I have an updated version that now includes 3 ways to have online updated, both here with our Breathe Easy events, COPD Navigator monthly offering in, weekly offering in Kalamazoo, Michigan at Western Michigan University. It's a wonderful offering. And we have a new one that I really want to encourage you to look at, and that is the Ultimate Pulmonary Wellness online. I have all the information either here today for the group here or contact me. I'll be glad to send you the information. But basically, this is probably the largest support group in the United States for people with respiratory problems. Over 10,000 patients are actively on this site all the time. And I've been on the COPD journey for about 23 years. My colleague, Dr. Noah Greenspan, is a physical therapist. He's been on this journey 26 years. And he's coming from a physical therapy perspective. He does a wonderful job. He has a respiratory therapist from Texas named Mark Mangus, who does a great job of medication input. And they together have co-authored this book, and they're updating it all the time. But what's really neat about this site is it's 24/7 anytime, and they have a lot of webinars as well. So I just want to encourage you with that site as well, wherever you're at during the summer, to enjoy the summer. But I just want to get that house cleaning in, and I want to thank Deborah and the great job she did to help us up with the appreciation of Pulmonary Rehab. And Radhika, thank you so much for everything you're doing, and I just want to thank you for joining us today.